We've all heard the stereotype that British people have bad teeth, but the problem is actually
much worse than anyone realizes.
The National Health Service Dentistry of England is broken. There is a health crisis in England, forcing patients to have to pull their own teeth out and place their own fillings. So where are all the dentists? To answer that, we have to go back to 1945, when over 75% of the population had fake teeth. The Brits got so tired of Americans making fun of their teeth that they decided to do something about it. Enter Aneurin Bevan. 1945 was when the NHS was born. He stated that the health services should be comprehensive, universal, and free at the point of delivery. So just like Oprah giving out free cars, the government of England started giving out free dental care. The core principles: free at the point of delivery, meeting the needs of everyone, and not based on the ability of one to pay. NHS dentistry exploded, and dentists were super busy. They went from seeing 15 patients a day to 100 patients per day. Things were good. Oral health was improving, dentists were busy making money, but where was this money gonna come from? Enter Winston Churchill, who said, hey, we're gonna actually need to charge money for this dental care. To which Aneurin Bevan said, well, then I resign. For the next 50 years, the program survived, but with problems and inefficiencies, up until about 2006, when things started to really break. The NHS Health Committee decided to make changes that would simplify the pricing model, grouping appointments into units of dental activity, which has led us into the conundrum we're in today. Dentists in the British Dental Association at the time argued that this system was flawed, with low reimbursement for treatment and rates that didn't make sense for the patient or the provider. With units of dental activity, it meant that if you had one filling, you would pay the same amount as if you had had 10 fillings. So patients might decide to save up dental treatment and get it all done at once, rather than going in for a single tooth at a time. The dentist got screwed too. Two completely different patients with different needs that would take the dentist different time to fix would pay the dentist this same amount of money. For the next 16 years, NHS dental access declined as dentists walked away from the program. And I can't blame the dentists. I probably would have walked away too. Peter Ward, the chief executive of the BDA in 2008 said, they've failed to improve access to care for patients and failed to allow dentists to provide the modern preventative care they want to deliver. Instead, this contract encourages sporadic, episodic treatment rather than long-term, continuing relationships that dentists and patients value. In 2020, COVID broke the NHS dentistry for good. During the shutdown, offices were closed, and the NHS set up 600 emergency clinics and said that dentists on contract would be paid 16% less for their work. Add to that a new public health measure put into place called fallow time. This meant dentists had to wait 1 hour between patients so that the room could be cleared of airborne pathogens. This idea had no evidence to support it and only further strangled the dentist's ability to treat patients. The NHS stated that they expected dentists to maintain 100% capacity and threatened to claw back or take money from the dentists who were on contract if these requirements were not met. More than 8% of dentists have completely left the NHS since 2020, and the remaining participating dentists have significantly reduced their participation. So how did the NHS decide to address this problem of dentists leaving and patients doing their own dentistry? They poured £50 million into the broken system and asked doctors to work weekends and evenings. It's estimated that it will take £880 million to restore the system back to 2010 levels. So for now, we're stuck with a massive waiting list for treatment and more dentists leaving the system. From April 2020 to December 2021, 40 million less courses of treatment were administered. So Britain is heading towards a public health catastrophe, and their bad teeth problem may be getting worse before it gets better. If you enjoyed this video, be sure to subscribe to the channel and to the eval newsletter. Link in the description below. Thanks for watching.